Hello guys, can you hear us? Can you see us? Can you hear us? Hello. Okay. Hi guys, I hope I'm audible and visible. Along with me, I have Dr. Sandeep Sir. This is just uh, casual discussion about for all the second year students who have been consistently messaging that second year is completed and things are going on smooth. Now I'm in third year. Most of my seniors said third year is in honeymoon phase, right? So especially this batch of third year has only PSM and forensic, and seniors advises you can do both of the subject in 10 days, enough. So what do I do? Should I read ENT Ophthal or should I read medicine, surgery, OG pediatrics? To discuss that, we have Sandeep Sir. Sandeep Sir is a thoracic oncology specialist working in AIMS, and Sir will be guiding us through on what exactly to do for the postings, for how to do take care of the second year. Should they read the third year? How much involvement should be there in clinical? Sir, over to you, sir. I'll be intermittently asking questions what students have told, and I hope we'll have fruitful discussion.
Hi guys, good evening. Good evening, Ranjith Sir. Thank you so much for this small session. I mean, you've been bombarded with a lot of questions, especially from your second year batch. कि सर थर्ड ईयर तो हनीमून पीरियड है ना, 2 सब्जेक्ट्स हैं, 12 महीने हैं, क्या करेंगे? See, this is something that we've been hearing year after year. मोटा मोटा अगर आपको मुझे समझाना है कि थर्ड ईयर वी विल कंसिडर एज अ मेक और ब्रेक फॉर योर पीजी प्रिपरेशन. इट इज ऑल्सो अ टाइम फॉर यू टू गेट ओरिएंटेड ऑफ हाउ थिंग्स आर गोइंग टू शेप अप. आपकी लाइफ किस डायरेक्शन में जाने वाली है, आप क्या करोगे. देखो, यू नीड टू हैव गुड टाइम, एंजॉयमेंट, फन एंड ऑल दैट इज गुड. लेकिन 2 सब्जेक्ट्स 12 महीने इज नॉट जस्टिफाइड, है ना. तो ये तो लॉजिकल और कॉमन सेंस भी बताता है कि अगर 12 महीने आपको दिए हैं और आपको सिर्फ 2 सब्जेक्ट्स दिए हैं, तो बेसिकली दी बोर्ड वांट्स यू टू बी प्रिपेयर्ड. या तो आप पुराने, आप फर्स्ट ईयर सेकंड ईयर के वापस ब्रश अप कर लो थर्ड ईयर में ताकि आप स्ट्रांग रहो, या लुक फॉरवर्ड, क्योंकि आपका फाइनल ईयर का क्लट इज गोइंग टू बिकम सो हैवी इन दोज 18 मंथ्स कि माइंड का बैंड बजने वाला है. और बैंड बजाने के लिए 2 मेजर सब्जेक्ट्स है अपने, स्पेशली मेडिसिन सर्जरी. मेडिसिन राइट से मारेगा तो सर्जरी लेफ्ट से, बचा कुछ आपका ओबेजो पीडियाट्रिक्स खा जाएगा, है ना. So I would strongly recommend कि बेटा let's look a little bit forward. Let's see कि what is there in reserve आपके लिए आगे क्या रखा हुआ है. रंजीत सर will also agree कि बेटा जो आपका फाइनल ईयर है ना, it is a test of your first and second year. अगर आप मेडिसिन पढ़ रहे हो, you need to have your physiology strong, your biochemistry strong, your pathology strong, your microbiology. सर्जरी पढ़ रहे हो, एनाटॉमी के बिना नहीं जाओगे, अगेन सेम पैथोलॉजी, सेम फिजियोलॉजी, सेम फार्माकोलॉजी, तो अप्लाइड है ना. So it is a good time to pick those up. So how will we do that? What is the strategy? कैसे पढ़ना है, क्या करना है? We will have a small interaction with Ranjith sir also. So Ranjith sir, rather than you trying to give me a question, I have one question for you, because you have held all the students in your second year and you have done a tremendous job, the entire team per se. तो आप मुझे ये बताओ कि जिस बच्चे ने फर्स्ट ईयर पढ़ा, उसके बाद सेकंड ईयर आया, सेकंड ईयर में भी उसका बैंड बजा, उसने सेकंड ईयर भी पढ़ ली, अब वो फाइनल अभी थर्ड ईयर में जा रहा है ना. तो हाउ डज ही मेक यूज ऑफ दोस फर्स्ट 2 years इन दिस थर्ड ईयर, एंड ऑल्सो थिंक कि उसको फाइनल ईयर के सब्जेक्ट कैसे कवर करने हैं. सो व्हाट शुड बी योर एडवाइस ऑन दैट?
Thanks, sir. So putting to my the question to me, I thought I'll be asking questions and Sandeep sir will be mostly answering, but the question has come back to me. Sir, what generally I say to every student who asks like what to do in the third year is, in second year itself, the one thing which I consistently say them is do attend your clinics, which is very, very important. You might not understand diagnosis or you might not understand the surgical steps or medical differential diagnosis, but what they will understand is history taking. So that is something which is very simple. So I tell all the second year students during the time of second year, please learn how to take history. Talk to them. You need not answer questions was asked by the professors. If they answer, seniors also will scold, professors also will scold. So both problems are there. So at least go there, take history. So and once they come to the later half of second year, so they'll definitely try to understand, okay, this is CBC. So a case of anemia, they can correlate little by little, not go into the diagnosis of glomerulonephritis. Hematuria, if there's a symptom, they can understand something problem in the glomerulus, right? Or there's a problem in the let's say abdomen mass. They can say, okay, it's above the peritoneum, below the peritoneum. Something they can definitely be able to correlate, right? That's what I generally say them. That's what to do in second year. So once they come to third year, my general advice for them is, since they have 2 subjects, most of them are very relaxed. And now we are seeing the current batch of final year, they're struggling. 6 subjects, theory, practical, it is tough, right? In our time it was just 4 main subjects. Now it's
Correct.
2 extra, so they're struggling. So I would say them, at least do it like older batch only. Cover ENT, cover Ophtha, cover PSM, cover forensics. That's what actually the Shushita batch of MedEd does. In addition to that, also maybe like I would say like surgery, may you try to complete thyroid breast too. In medicine, try to complete CVS RS too, so that when you go to final year, you need not start from zero. At least something they have to do it. This is what generally I do. But sir, from your experience, what should a third year student do? Because surgery, it is vast, and surgery cannot be completed in one posting. They
Sir,
might see all the cases in one posting, but it's very difficult. So what do you tell them, someone who started their third year, how to balance their theory as well as practical? Your opinion, sir.
Uh, again, sir, I mean, it's a very practical question that we get bombarded all the time. What you said is correct, because there's a lot of, subjects to be covered in a final year alone. So if you look at from a neutral standpoint, you have a lot of time in your third year. How do we utilize it? You cannot go read entire medicine surgery, which is not possible. At the same time, reading entire ophthal ENT as we used to do it is also difficult because there's no motivation to do so, right? So let them get oriented, whatever history taking that they have done in their first year, second year of clinics, whatever orientation that they have. In third year, you might not have more of ward rounds, but then you'll have a lot of time to revisit those. So the ideal thing would be choose your battles. Like for ENT, finish ear, if not nose and throats, right? In ophthal, you can at least, start with basic cataract, which are important one. Retina, you can finish. Those are topics which are interesting also. You will like reading. You get a lot of resource material. We have amazing teachers like, Sudha ma'am and Sanchit sir. I mean, like you will fall in love when you start looking at them. Get those few topics which are considered to be a bigger one. Use the resources and finish it off. Coming to medicine and surgery, I mean, like these are the two things which you'll be lost in ocean. So yes, as Ranjit sir said, let's prepare early, pick our battles again. In medicine, what is the most important system that you can think about? Again, it is going to be CVS and CNS. ठीक है? Again, CVS CNS अगर आप एक बार पढ़ने जाओगे तो नहीं पता चलेगा, बहुत डिफिकल्ट है. I do understand. लेकिन अगेन उस वी हैव अ वेरी गुड संतोष सर अमेजिंग, उनका सीवीएस का एक बार लेक्चर देख लो, उनकी जो फिजियोलॉजी चलती है दैट इज ऑल्सो अमेजिंग. सो रिवाइज दैट. तो आपका एनाटॉमी फिजियोलॉजी का रिवीजन हो जाए, क्योंकि आप सर्जरी भी पढ़ोगे और मेडिसिन भी पढ़ोगे. मेडिसिन में सीवीएस सीएनएस उठा लो. इन सर्जरी आई वुड एडवाइस, जैसे रंजीत सर ने बोला है, आप थायराइड ब्रेस्ट के बिना कुछ होता ही नहीं है, ठीक है? तो थायराइड ब्रेस्ट पढ़ लो, उसके साथ ट्रॉमा अगर आप पढ़ सकते हो, नहीं तो कोई एक सिस्टम उठा लो. जीआईटी बहुत आसान है, इट इज अंडरस्टैंडेबल, इट इज इट इज समथिंग दैट यू सी ऑन अ डेली लाइफ. यू विल बी एबल टू गेट टू दी हिस्ट्री टेकिंग का वो एडवांटेज भी मिल जाएगा जो आपने पहले पढ़ा हुआ था, वो आप अप्लाई भी करोगे. क्योंकि आपने पैथोलॉजी में, जैसे फॉर एग्जांपल रंजीत सर वुड हैव टोल्ड यू अबाउट लेट्स से थायराइड कैंसर्स में समूह बॉडीज के बारे में बताया होगा, ठीक है? फिर पैपिलरी कैंसर के अदर वेरिएंट जैसे ऑर्फन एनिया न्यूक्लियर हो गया, वो आपको यहां वापस मिलेगा. आपको एमिलॉइड इन स्ट्रोमा मेडलरी कैंसर थायराइड में मिलेगा, वो मैं आपको वापस एक कंपैरेटिव स्टेटस में बता दूंगा क्लिनिकल प्रेजेंटेशन के साथ, वो कंसोलिडेट हो जाएगा. फिर आपने थायराइड स्वेलिंग देखी होगी, मैं आपको बता दूंगा कि यार गॉइटर, सिंपल गॉइटर, नॉडुलर गॉइटर, टॉक्सिक मल्टी नॉडुलर गॉइटर में फर्क क्या है, हाउ डू यू डिफरेंशिएट क्लिनिकली, एंड देन यू यूज इट. सो ऑल दिस इज गोइंग टू हेल्प यू. सो स्प्लिट द फाइनल ईयर इनटू सब्जेक्ट्स, और सब्जेक्ट्स के टॉपिक्स उठा लो. ईएनटी में ईयर कंप्लीट कर लिया, ऑफ्थाल में आपका कैटरेक्ट रेटिना हो गया, सर्जरी में आपने मेडिसिन आई मीन थोड़ा सा लेट्स से थायराइड ब्रेस्ट के साथ जीआईटी कंप्लीट कर लिया, आपने सीवीएस सीएनएस मोटा मोटा पढ़ लिया. What this will do is when you go into final year, you will not feel alienated. आपको ये नहीं लगेगा कि यार ये भी नहीं पढ़ा, इतना नहीं पढ़ा, वो नहीं पढ़ा, because you have touch with all these subjects, and when you enter, it will become easier for you. Medicine also lays path for your ऑब्वियसली पीडियाट्रिक्स. और सर्जरी में मैं ये नहीं बोल रहा कि पूरा ऑप्शन का ही नहीं मिल जाएगा, बट पेल्विक एनाटॉमी अगर आप जीआईटी पढ़ रहे हो, रेक्टम एनल कैनाल पढ़ोगे, तो पेल्विक एनाटॉमी के अगेन ओरिएंटेशन हो जाएगा. तो अगेन वहीं पे आपको ओवेरियन कैंसर या फिर ओवेरियन ट्यूमर्स या ओवरीज, यूट्रस, एवरीथिंग विल बी देयर ओनली. तो वो ओरिएंटेशन बहुत इंपॉर्टेंट है. तो फ्रॉम माई साइड, लेट्स ब्रेक द फाइनल ईयर इनटू सब्जेक्ट्स, और सब्जेक्ट्स में से टॉपिक्स पिक करते हैं और उन टॉपिक्स को हम थर्ड ईयर में कंप्लीट कर लेते हैं. सो दैट वुड बी माई एडवाइस. बट अगेन, हाउ डू वी रिवाइज फर्स्ट सेकेंड ईयर का जो पढ़ा हुआ है, दैट रंजीत सर विल टेल अस, बिकॉज ही हैज मोर एक्सपर्टीज ऑन हाउ टू हैंडल द फर्स्ट 2 years.
So thank you. So again, the question is back to my quote. So, sir, what I generally perceive is like, let's say there's a case of breast cancer. So when you start discussing about breast cancer, first is obviously be the diagnosis. How did you arrive to a diagnosis? Then the surgical management will be there, staging will be there, and everything. At some point of time in the management, in surgery also, ERPR HER2 will be covered. So it's not just surgery, it's along with the surgery, the hormonal therapy, who requires chemotherapy, all those things. So what they have done in second year is they have studied the variants of breast cancer. Lobular cancer will be treated differently, the ductal cancer, medullary cancer, metaplastic, inflammatory, they already have the base. So instead of reading the same thing again in Bailey, Bailey covers everything. But I would say, since you have already done that, quickly revisit the notes. And then when you go to surgery, you will read the surgical plan. You will read the surgical treatment. So surgery will not become one more extension of pathology. It will become an extra added layer of knowledge from surgical aspect. Same I would say for medicine also. Agar if they know physiology and pathology, Santosh sir will focus more on the management and the way to handle complications and treat complications. If they quickly revise because they know what case they're going to take tomorrow. So if they quickly revise from at the hostel or at the home, okay, this is the renal physiology, this is renal pathology. Let's go and see how to manage glomerulonephritis. Not again go and talk what is PSGN, what is streptococcus. That might be a waste of exercise and time for them, right? This is what generally I tell them. Sir, one more question. There are two categories of students. One, a college which has good caseload. The colleges have more than 150 students, some 200, some even 250 students. That the batch number increases a lot. So what happens is seniors who are the presenting exam going batch, they get to present. They are already tensed that the professor is going to ask many questions. And they are not able to interact properly in the time and say this is required for history taking, this is required for examination. One more set of students, a new college, where there is not much of a guiding senior to tell, right? So this is one reason that with the help of Sandeep Sir, Satso Sir, Divya Ma'am, and Prithvish Sir, we have created an entire clinical corner. It's based on their experience, what is required for thyroid examination, what's required for breast examination, with their inputs, and also a little bit of Viva question which can be asked. Sir, how do you think a student who is not having enough time to spend from seniors because they are still running to complete the exam, or there is not a guiding force, they're the fresh, they are the senior, how do they use the clinical corner? Your opinion, sir?
Right. I mean, I really wanted to share this with all our students that we have started. I mean, those who are not aware, a new segment called as Clinical Corner. Now, it is not something entirely new, but then we have, packaged in a way that it is useful for you. For example, whenever we talk about any clinical case presentation, it all starts with history taking. After history taking, you have the inspection and then the palpation, correct? So what you will miss out in general is palpation, because that I cannot bring you through the screen. But in the clinical corner, we have made an attempt. If I'm giving you an inspectory findings, those findings are visualized. And then based upon that, what questions, as see, I am now in a teacher's position, you are in a student's position. So I know that what my student might know or might not know, and anticipating those, we have curated a set of questions. For those questions, I have also given the answers what an examiner would be expecting. So you now know how much to say. See, whenever the question is asked, no, nobody wants to know how much you know. It's always what is asked. Are you able to answer that question or not? For example, in a breast examination, I would see that there's a nipple retraction. Now, the first question I'll ask you is, why does a nipple retract? Now, you will say, sir, because there is tumor, it is infiltrating the underlying tissue, it is going to involve Cooper's ligament, there will be subductal involvement and all that. Then I will be like, no, this is not the answer I want. I want you to tell that the TDLUs under the cellular surface is getting infiltrated and hence it has been pulled. So usually it is a sign of infiltration which is seen in malignancy. End of discussion. If I ask you what is the other condition where you can have a nipple retraction, apart from malignancy, I will expect the answer to be ductectasia, right? In the same way, why does dimpling occurs? You give me, all those answers. No, dimpling is because of infiltration of Cooper's ligament. Does it change the staging of a breast cancer? The answer is no. So all these questions from a teacher's perspective, which is anticipated and asked to the students, and I know what are the pitfalls. I know where would a student probably not answer. I know a good student would answer these, an average student won't. So we have tried to curate all those questions and build a scenario where you will be ready. So yes, a clinical corner is a very, very good resource where you will be able to experience all this. Now, those coming to Ranjit Sir's question, in a college where you don't have a helping hand, in a college where your seniors are like, let's say there's a new, relatively a newer college where you don't have, batches which have gone through to guide you and put you through that system. Even if you're in a college where your seniors are not that helpful, or you are shy to ask questions or approach, for them, again, say we have designed it in a way that we are available 124/7. We have all the support system that we can create. But in a clinical corner, we have given you the objective how to approach a case from the bedside to the diagnosis. How do you ask right questions? How do you think that a particular form of question will be altered or asked or can be anticipated in terms of examination? We have given you how do you inspect, what is the correct way of inspecting, what is the right way of standing, which side should of the bed you should be standing, which side you should not be standing, the reason for that. If there is a question, what could be a follow-up question? And then how do you approach a particular set of questions? We have given you a performer, we have made up, even a practice module for you. We have given you a hypothetical case scenarios and our solutions to that. So this will guide you to get through all those which you think you are at a disadvantage because of lack of guidance or a lesser patient load. We have covered you from there. So yes, it is going to be a very good resource and it will help you to solve all the problems. Now, Ranjith sir has been very instrumental in developing this clinical corner whole component. I would want Ranjith sir, because you are his students who are coming to third year now, I would want him to give you an advice how best can you use it. See, I'm telling you from a final year perspective. You are right now in third year, you have gone through a second year. So Ranjith sir will be able to tell you better that what is exactly that you can use it from a clinical scenario. I've told you what it exists and how can you make it better from your preparatory point.
So thank you, sir. Thank you very much for the question. And like I said, it's a combined effort of all the teachers, their inputs on how to improve and everything. The vision of why we had the clinical corners, like generally when I was an MBBS student, we used to have something as a pro forma. We take a Xerox from the senior. Sometimes some of the letters will not be legible. Some would have scribbled something, and it's a huge book of spiral binding. Taking it through multiple places, keeping it in a OPD, keeping it in a ward and taking it, putting it in the bag, that is a bit of a cumbersome process and it's not neat and legible. It is not like, okay, these are the things required. Something might have missed, something might have been extra. So the whole purpose of creating clinical corners, let it be easily available for them and it's free for every student. It's not that something who has to pay. You just download the PW MedEd app. In the homepage, there'll be a clinical corner. You can click on it. You can just start reading. So whenever you have a patient in front of them, they have to ask the age, they have to ask the name, they have to ask the gender. We are trying to also tell why the age, how it can contribute to the case. A particular case of breast cancer, definitely age is one of the important risk factor. So that also will be there inside, right? And then they go systematically. It's not just a compilation of what is required. It's a systematic approach what's required. So every single day they start looking at the clinical corner and see the patient, the rhythm gets into the place. So first I have to ask this history, second I have to ask this history, third I have to ask this, so that they don't miss anything. At the same time, they complete everything required from a teacher's perspective, from a professor's perspective, who's going to listen to their case presentation. That's the agenda of bringing a clinical corner. So I would say for all students to regularly use it, even if you're not taking a case, your friend is taking a case, you can see them. Maybe you can help the friend. Like, see, you missed this. The same vice versa, the friend also will do to you. So you both learn together. So it's not just that, okay, today I take a case only once in a week. I will open clinical corner once in a week. When you start doing that, the continuity breaks. Every day, someone of your friend is going to present. So you be behind. When you present, be the front person. When you don't present, be behind. Just check if everything is done, like a checklist. So if it's not done, tell them. So whenever you correct someone, you also get to learn. So that's the approach I want the juniors to do for clinical corner. That's a very useful thing. We are improving it, like Sandeep said. We'll put more and more teachers' perspective questions so that it becomes a one-stop solution for all their practical needs. Sir, Sandeep sir, you have a student asking you, sir, BLS series कब start होगा?
Uh, Sir, BLS series, I mean, those who do not know, BLS, it's a series which is called as Bailey and Love Learn with Dr. Sandeep. Our objective was to bring the best of the medical education on YouTube, free for every single medical student, not across only in India, everywhere. So we have basically simplified Bailey in our own style, or we've been teaching that. I mean, we have done more than 100 hours of Bailey and Love on the YouTube. One of the reasons that we were taking a small break, as Ranjit sir also knows, it's an exam season. The season where You have INI, CET, FMG exam, and NEET PG happening, and then that's the phase where we all get usually caught up a lot. And I do need to cater my students who are going to the competitive exams also. So because of that, I was not able to take the time out, as I have promised every single student who is associated with BLS that we will complete entire Bailey and Love cover to cover. It will happen. Yes, I know I get a lot of messages. One thing that is consistent on my Instagram, my Telegram group, at least one message a day is, sir, when is BLS starting again? I know I also miss interacting with you guys. I love those sessions. It was something which is, I started because it is truly close to my heart, but it has grown into really something which is quite aspiring and equally inspiring. Looking at you guys, I mean, I all the love and support. I can't shy it away, and I can't pull back. Also, we will start, and trust me, this time when we'll start it, I mean, we have discussed in detail with Ranjith Sir also. We'll give you a pre-set decided topics. It will be like a short burst where we'll try to finish that topic in a week only, so that I can also get a little breathing space. You will also have it. We're trying to restructure a little bit so that we all can be on the same page. But yes, BLS will be one-stop solution for every single medical student who wants to learn surgery as surgery. So that's a promise from my end.
So thank you, sir. Like one more question I want, like whenever I used was there in Nischay batch of students, I say that Robbins is something which cannot be replaced. I am a hardcore believer of books can never be replaced, whoever comes. So especially considering they have good amount of time for final year, that is a surgery exam, who is in third year, what should they do? Like, what should their approach be? Should they start reading Bailey, or they stick to BLS, or read see BLS and then go to Bailey? Since they have good amount of time, is it wise for them to read Bailey and Law first? If so, how to read them? So I'll ask the same question with Santosh sir tomorrow when he comes for Harrison. But your perspective on how to take Bailey as a book.
I mean, sir, I am somebody who is in absolute love with textbooks. I like the feel of it. I like the smell of it. I am that, old school guy where I love paper. I need that paper in my hand. So I tell every student in a medical education that you should read 4 textbooks cover to cover. I mean, you should make that habit that you should finish it. One is Robbins. Without that, I mean, there is no basis of it. I mean, that's one of my favorite textbooks even until today. Another one from a surgeon's point of view, a surgery of textbook. I would recommend you to read Grey's Anatomy. If not, then at least BD Chaurasia. There are 2 textbooks. Medicine is Bailey and Love. Without that, there is no love in life. And Harrison's, that is like the ultimate of all textbooks. It is the OG of textbooks in the current Gen Z's language. So I would recommend every single one of you to have these 4 textbooks, read them, make an effort to read cover to cover. Coming to surgery, Bailey and Love is in 2 volumes. The beautiful textbooks. Everybody should have it, should read it, buy it now if you're in third year. Don't wait for the final year. The new edition might come this year, but then it's totally worth the investment. How do you read Bailey and Love? Sir, Ranjith sir, you should also agree to this that we have audience starting from North India to South India, then you have East India, the West India, the language is different. There's a lot of barrier association. Even in South, you have students who don't, really come from a very strong background, like people who have studied from government schools, cracked well, got into the medical school, and then you have these textbooks which are foreign written. I love Bailey and Love, but one thing I am not very fond of is the language in which it is written. You need to have a really good English language to in order to understand, and especially the clinical part of it, how they're interpreting. It's very easy to misinterpret things, written in Bailey something and you're thinking about something else, right? So in those things, it just really crosses at multiple problems. For me, I could see that. I have students who have come, from Andhra, Telangana, or from Tamil Nadu. As a matter of fact, from North also, let it be from any other state. They have reached out, ki, sir, I mean, I'm not able to understand this concept because it is written in this way. I'm not able to read Bailey and Love because it's not reading 30 pages. It's processing those 30 pages and making an effort to read it. It makes it difficult. And that was the driving force for me to start BLS. I said, oh, uh, every single student deserves to learn, and they deserve to learn better. And there is no other better resource than this textbook. The only problem is you're not able to decode this textbooks, right? So I am just here to simplify that one chapter of Bailey in our own language. I make it simplified English. I use Hindi also. I mean, there are a lot of audience who are there. We had this thing, no, कि सर हिंदी में पढ़ाओ, हिंदी में पढ़ाओ, हिंदी में पढ़ाओ, नहीं समझ में आ रहा, थोड़ा हिंदी यूज करो. वी गॉट इट. बीएलएस के पहले 20 घंटे आपको सिर्फ इंग्लिश में मिलेंगे. उसके बाद से एवरी सिंगल लाइन दैट आई से इन हिंदी इज आल्सो सेड इन इंग्लिश, इन आवर लैंग्वेज, लाइक इट्स आवर इंडियन इंग्लिश, जो आप समझ सको. तो आई हैव मेड इट दैट टू अ पॉइंट वेर यू कैन सिंप्लीफाई इट. एंड देन ऑब्वियसली क्योंकि मैं बोल रहा हूं, इट इज फॉर यू टू हैव अ विजुअल परसेप्शन, ऑडियो परसेप्शन, तो वो रिटेन भी होता है. अब कैसे यूज करें थर्ड ईयर में? क्या मैं टेक्स्ट बुक पढ़ के आके बीएलएस अटेंड करूं या बीएलएस देख के टेक्स्ट बुक अटेंड करूं? बेटा, बीएलएस इज अ मिरर इमेज ऑफ टेक्स्ट बुक. ठीक है, सो आई हैव नथिंग डन एनीथिंग न्यू. जो आपके उस टेक्स्ट बुक में अवेलेबल है उसको मैंने बीएलएस में प्रेजेंट कर दिया है. अब शुड वी रियली थिंक अबाउट ओनली लुकिंग एट बीएलएस? आई वुड रेकमेंड यू नो, क्योंकि मैं चाहता हूं कि आप थोड़ा एफर्ट डालो. 1 घंटे का जो लेक्चर है दैट विल बी प्रोबेबली, इफ यू लुक एट योर बेली एंड लव टेक्स्ट बुक, 3 या 4 पेजेस का टोटल जो इन्फो है वी हैव गिवन इन 1 hour ऑफ लेक्चर. Watch that 1 hour of lecture. Go start reading. I'm telling you, without doing BLS, you start try to read that Bailey and Love का जो 4 पेज है, it will take you 4 hours. After you have done Bailey and Love, that is BLS का अपना सीरीज अपना अगर वो घंटा कर लिया, and then you go back and read it, you will finish those 4 pages in 1 hour. So now you have revision also. पढ़ भी लिया, समझ भी लिया, रिवाइज भी कर लिया, तो रिटेनमेंट बेटर है. अगर आप BLS के बिना जा रहे हो तो 4 घंटे का इन्वेस्टमेंट है. With BLS, it is 2 hours of investment. So you are smart enough to make a logical decision. But every single student start BLS in the, जैसे आप थर्ड ईयर में जैसे एंटर कर रहे हो, you have a lot of time. I have 100 hours of videos which is already available on YouTube, which is there for Bailey and Love. By the time you finish 100 hours, you'll have another 100 hours. Total Bailey and Love का series will be 250, 260 hours. Don't worry about it. लेकिन it's totally worth the time and investment because we cover from the anatomy to the surgery, and that too in the best possible way. So yes, Bailey and Love has to be started as early as possible.
Great, sir. I hope most of the students here will jump directly to the Bailey Love series, which you have put as a playlist, and hope they will binge watch it. Right? Generally, we don't binge watch medical lectures. I hope they will binge watch BLS lectures. So Raghuraj has a question like, what do I do? Like, should I revise first and second year subjects now, or should I start final year subjects along with DNT Optal? So, what is your advice from your perspective? What should a student do?
So we've been discussing this from the very beginning of our session. We're going to fro. I mean, should we really jump into final year? Should we think about first, second years? Beta, again, the concept is very simple. द फाइनल ईयर में जो सब्जेक्ट्स हैं, मेडिसिन हो गया, सर्जरी हो गया, जिसकी हम मेजर बात कर रहे हैं, वो आपके फर्स्ट सेकेंड ईयर का ही रिविजन है. सर्जरी क्या है? एनाटमी है. ठीक है, उस एनाटमी के ओरिएंटेशन पे फिजियोलॉजिकल चेंजेस हैं. उस फिजियोलॉजिकल चेंजेस में क्या पैथोलॉजी डेवलप हुई है, उस पैथोलॉजी को आप मेडिकली ट्रीट कर सकते हो या सर्जिकली ट्रीट कर सकते हो. मेडिकली ट्रीट करोगे तो फार्माकोलॉजी आ जाएगा, है ना. अगर फार्माकोलॉजिकल अटेम्प्ट का भी फेलियर होता है, एंड दैट इज समथिंग दैट यू कैन नॉट हैंडल मेडिकली, आपको उसको सर्जिकली रिमूव करना है. सर्जिकली रिमूव करने के लिए आपको एनाटॉमिकल ओरिएंटेशन होनी चाहिए. तो बेटा, फर्स्ट ऑफ ऑल, मेडिसिन सर्जरी दो अलग सब्जेक्ट नहीं है. इट्स अ कॉम्बिनेशन ऑफ योर फर्स्ट 2 years ऑफ सब्जेक्ट. तो यू विल कंटिन्यू टू रिवाइज एज यू रीड योर फाइनल ईयर सब्जेक्ट्स. रंजित सर हैज गिवन यू अ ब्यूटीफुल ऑब्जेक्टिव कि अगर आप ब्रेस्ट पढ़ रहे हो, अगर हम ब्रेस्ट की बात कर रहे हैं, ब्रेस्ट की पैथोलॉजीज जब आती हैं, आपने पैथो में ऑलरेडी पढ़ रखा है. rather than trying to read it from the Bailey and Love perspective, आप जाओ रॉबिन से पढ़ो. पढ़ तो रखा है और जल्दी पढ़े हो क्योंकि आपने ऑलरेडी यू हैव रेड इट, यू हैव रिवाइज्ड इट, यू नो इट. आपका रिवीजन जल्दी हो जाएगा. आपने पढ़ा, आपको अब आके क्या देखना है? संदीप सर ने सर्जरी में क्या पढ़ाया है, क्या है जो उस कंडीशन की फाइनल डायग्नोसिस कैसे हो, मैनेजमेंट कैसे हो, पोस्ट ऑप कॉम्प्लिकेशंस क्या है, देख लिया, खत्म किया. तो इट इज अ रिविजन ऑफ योर फर्स्ट सेकेंड ईयर विद एड ऑन इंफॉर्मेशन फॉर योर फाइनल ईयर. इतना ही है. तो इसको अलग मत देखो. तो स्टार्ट, जैसे मैंने आपको बताया, फाइनल ईयर में आप ईएनटी ऑफ्थाल के सेलेक्टिव टॉपिक्स उठा लो. आपके लिए अगर आपको नहीं पता क्या टॉपिक उठाना है, वी आर देयर फॉर यू. वी विल टेल यू व्हाट टॉपिक्स टू बी पिक्ड. वी हैव अ शुश्रुता बैच. और आप मेडिसिन सर्जरी में यू कैन आल्सो पिक सेलेक्टिव टॉपिक्स. उनको आप थर्ड ईयर में इसी तरीके से पढ़िए. गो रिविजिट योर फर्स्ट सेकंड ईयर सब्जेक्ट्स. add on to your third year, I mean your final year subjects, and that is one subject for you. ट्रस्ट मी, ऐसे करोगे ना ये वर्टिकल इंटीग्रेशन हो जाएगा. बाय द टाइम यू गो टू योर फाइनल ईयर, इंटर्नशिप के टाइम में रिवीजन विजन सब सेट है, हर पेशेंट देखते ही डायग्नोसिस हो रहा है, आते ही आपको ना वो मरीज नहीं, आपको डिजीज दिख रही है, आपको मैनेजमेंट समझ में आ रहा है, पेशेंट वॉक्स इन, यू नो व्हाट टू डू. इवन बिफोर योर रेसिडेंट टेल्स यू, आप बोलोगे सर ये इसका डायग्नोसिस ये है, प्रॉब्ली डिफरेंशियल डायग्नोसिस ये है, इसका मैनेजमेंट ये है. आई एम टेलिंग यू दैट्स द बेस्ट फीलिंग एज अ डॉक्टर यू गोना हैव. स्टार्ट अर्ली, स्टार्ट वेल एंड बी कंसिस्टेंट. ये चीज हम बोल बोल के थक गए, बट देन ऑब्वियसली आप बच्चे हो तो थोड़ा टाइम लगेगा, लेकिन यही सक्सेसफुल मंत्र है. स्टिक टू इट. So that's my advice, Ranjit sir, for every single listener who have.
Great, sir. So I think we discussed quite a few things, what to do from the clinical perspective, from the theory perspective, from medicine surgery, and also the clinical corner. I think if there are any more doubts, you can you know us where to connect with. We are available on Telegram channel, SES Instagram page. You can ping us, and hopefully you will complete this batch soon. And most importantly, your seniors will complete their biggest ever final year exam soon. We'll get more inputs from them also. I hope. We'll be able to, you guys will be able to do very well in your final year. Don't worry. Some things might be difficult, but definitely it'll also sail, and we are there to help you in that tough time. Over to you, sir.
Uh, Thank you so much, sir. I mean, this was a great opportunity connecting to younger crowd, and specifically, you guys, you need that a little bit of push, a little bit of orientation. You need that path, and we were trying to, clear that path for you, give you a roadmap so that you can execute. सब लोग जो अभी थर्ड ईयर में जाने वाले हैं, उन सब के लिए एक ही है कि बेटा यूज दिस टाइम वेल, बी गुड टू योर सेल्फ. थोड़ा सा एंटिसिपेट कर लो आगे जाके क्या हो रहा है, उसको अभी से मैं थोड़ा ना अपने ढांचे में डाल लो. पढ़ाई भी करो, मस्ती भी करो, लेकिन एट द सेम टाइम इतना याद रख लेना कि अगर कुछ ज्यादा ही मस्ती कर ली ना तो फिर आगे जाके पछताना पड़ेगा, क्योंकि आगे जो बैठे हैं ना वो बड़े बड़े सब्जेक्ट्स हैं, तो उनको थोड़ा यूज कर लेते हैं. स्टिक टू द प्लान. हमारे पास जितने भी रिसोर्सेज हैं, वी आर देयर फॉर यू. वी आर one platform where we try to be with students, listen to you guys, deliver what you want, and we're always there. We do EYT sessions, we do app sessions, we do a lot of stuff in our app, which is also absolutely available for every single one of you to use it for free. Let it be a clinical corner or a daily question. YouTube में तो है ही हमारे, हम we are always there. We are always there for you. We will be your seniors for your guidance system. जो आपको लग रहा है आपके कॉलेज या आपके लाइफ में थोड़ा लैक्यूने है, we'll try to cover it up. And then before we close it, Ranjit sir, I have one question. Sir, I rag juniors. Is that bad? Beta, it is absolutely bad. मतलब किसी को रैग नहीं करना चाहिए. आप उनसे बातें कर लो, आप उनके साथ एक हेल्दी वो नोक-झोंक वाला रखो तो बेटर है. रैगिंग पर से इज वेरी बैड. यू शुड नॉट ह्यूमिलेट एनीबडी. ठीक है. व्हाट इज दैट? समबडी सेइंग पहले ये बताओ, क्या बताओ बेटा? ठीक है. और ये वहीं रह जाएगा, कोई दिक्कत नहीं है. तो 10 वाले पे ही रहे, वही बिस्किट खरीद के खा भी ले, कोई टेंशन नहीं है. ठीक है, चलो.
Okay, sir. Thank you, sir. Thank you for your time, guys. Thank you very much for your patience, and see you soon. Bye bye.
राइट, थैंक यू सो मच, बाय.